After she'd won 2 gold medals at the 2004 Olympic Games, Kelly Holmes revealed that just over a year before her triumph, she'd slashed her own body with a pair of scissors. Not once, but over a period of 2 months. Her purgatory started when she'd hurt her right calf during training. It was the latest in a long sequence of injuries that had dogged her athletics career, and she'd sensed that she'd never fulfill her goal. Unusual? Well, for a champion athlete, male or female, to become so depressed that they would self-harm may seem out of the ordinary, but in fact depression in sport is much more common than you might think. Chamique Holdsclaw, the WNBA star, confessed to having had suicidal thoughts and actually withdrew from playing after losing 2 of her grandparents. She suffered from clinical depression. The German football player Robert Enke took his own life after hiding the state of his mental health for months, possibly even years. Some sports stars struggle to find their place in the landscape and plunge into depression. Success and adulation are no protection against mental illness. In fact, they may actually trigger it. In the 21st chapter, I examine the relationship between sports and depression, and between exercise and depression. It's a study in contrasts. Competitive sports, particularly major professional sports with their imperatives to win at all costs, often introduce a pressure that isn't encountered in many other areas of life. On the other hand, there's research that indicates that physical exercise has a therapeutic effect on patients experiencing the symptoms of depression. Even a light program of stretching and yoga with a few minutes on the treadmill every day is shown to have a beneficial impact. The relationship is further complicated by gender and age. The paradox is that voluntary physical exercise can be a blessing. Training for competition can be a curse.